advises to fix forward head posture. What does that look like? This posture here, where you're forward like this. Sometimes there's a slouching of the upper back. Sometimes there's a hip pelvis that goes forward, okay, just like this. I'm going to move the camera around a lot in this live feed, okay? So forward head posture like this, hunchback, and also pelvis forward, okay? So that's a very common posture configuration. And forward head posture has been attributed to things like neck pain, headaches, upper shoulder pain. Over time, it can cause even upper back pain, mid back pain, and the wear and tear on the spinal joints and discs can lead to degenerative changes and not just pain, but also disability and a poor quality of life and also quantity of life as well. What forward head posture looks like on a spine model. So again, I'll be moving this live feed around. Okay, and if you're on the live feed, comment in the comments below, hashtag live, and if you're watching this on the replay, hashtag replay. So just so I know where people are coming from. As well, if you have any comments or questions, I will try to answer them right away in the live feed as well. If you catch the replay later on, then I'll answer them in the recorded replay later on as well. And if you're wondering who I am, my name is Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. My whole channel is devoted to helping you bend, move, and lift easier, stabilizing your back, strengthening your back, and also introducing people to corrective chiropractic care. Posture, first of all, again, aesthetically, it looks something like this. There's different degrees of it, obviously, and then a lot of times it's coupled with a hunched back posture like that, and also sometimes a pelvis. There's different configurations. Some people may have a flexed forward thorax and a forward head posture. Some people may have a posterior translated thorax and a forward head posture, okay? So on a spine model, so you always want the ear to line up with the shoulders, hips, knees and ankles when you're standing. So on a spine model, C2 lines up with C7, C7, and T1 lines up with L, T12, L1, L1, and T12 line up with S1. Okay, so that's the position, and the cervical spine should be circular in shape from the side. So when there's a forward head posture, it actually drives forward. Okay, so now all these discs are being compressed on the front side, the muscles are being stretched on the back side, and it doesn't just cause pain and irritation, disability. It aesthetically, many people don't like the fact that they have this forward head posture. It creates that hump at the very top here. So people call it the neck hump or dowager's hump at the very back over here. So we want to reduce this, okay? So now there are advanced techniques that we do in our office. I'm a corrective care chiropractor, advanced trained in chiropractic biophysics. And if you ever want to look for a corrective care chiropractor or someone that's trained and certified in advanced chiropractic biophysics, comment below and I'll send you a directory where you can find one that does similar work like this, which involves mirror image postural corrections, mirror image adjustments, and mirror image traction. Okay, what normal posture should look like, okay, right there. That's a great example, okay? Over here is another good example at the bottom. And then you see the development of forward head posture over time, okay? Over time, gravity will always win when the actual posture position and spine's out of alignment. Again, there's different configurations of that. So we want to reduce that as much as possible. And that poster comes from a chiropractic biophysics and ideal spine. So first thing I'm going to do, I'm going to show you with this yoga block over here. Whenever you're improving the position, right? So if there's, let's do this right here. So this is live, okay? So again, if you're on live, comment live below. Let me know. I'm going to answer questions in the live feed as well. And if you watch this on the replay, let me know on the replay and let me know where you're from. So the challenge is that usually when there's a forward head posture, something else is involved. So if the neck is forward, the thorax may be back. So how do you fix both of them? Because you can't just work on the neck position, right? So you have to block the thorax. That's why I like to use a block or a yoga block. So I'm going to use the wall over here. Bear with me, okay? So I'm going to use the wall. I'm going to try to do this in such a way where you can see this. Okay, so I'm going to place this block. So thorax is back, right? This is one configuration. Thorax is back and head is forward. And I place this block behind my shoulder blades, just like that, nice and high, right there, okay? Okay, and just simple version. So let's get the hips and the ankles lined up. This is just one version, okay? And now from here, I'm going to pull the head back. So the block is blocking me, okay? And because we want to do what's called the mirror image, right? So ear and shoulder, right, is normal. That's forward. The mirror image is behind that ear shoulder line. So I'm going to pull back, okay? So we train our patients to do 10-second hold. Now, people can't start with 10 seconds at the beginning. It's a little hard. And we don't normally start these in the first week of care. We usually start them at about by the end of the first week and later on in the second week. But you want to hold it for 10 seconds. You want to not just move it there. You want to actually sustain the hold. Get those muscles activated. So the posterior neck muscles are being strengthened. Neurologically, all the receptors in your joints are also being retrained as well. So your brain is learning new positions, sending back feedback, right, to your body about the new position. You're stretching the muscles in the front. Hold that for 10 seconds. Feels really good, by the way. 10 seconds, okay? And you release and repeat that up to 20 times or more every single day, okay? And that's how you retrain your posture. So you want to block yourself with something back there, okay? Back, okay, just like that. Drive the pelvis back. The thorax is blocked, and now I bring the head back and I turn my palms out like this. So you open up those shoulders at the same time, okay? Feels really good, by the way, okay? So here we go. 1, 2, 3, 4. Hold, and you pull back, okay? Don't just stay there, okay? Hold, pull, keep pulling back. 10 seconds, release just a little bit, and then repeat up to 20 times or more, okay? So neck should be neutral to the shoulder, but the thorax is flexed, okay? There can be a hyperkyphosis or just a flexion of the thorax. So now you can do this prone. I'm not going to show you the prone version because I have to get on the table, but I'll show you against the wall. So if you're prone, right, and you're flexed, your body's on the floor or on the bed, and you want to do a thoracic extension off the ground, and you're really strengthening those posterior thorax muscles, right? Getting the head up like this, right? So prone, you're basically doing this, okay? You're doing an extension, which is opposite of the flexion. So posture correction is always mirror image of how you're presenting, okay? So sometimes with patients, we don't do prone, but I do standing. So standing, okay, I'll get the block a little bit lower. So imagine now the presentation is not like this, thorax translation, pelvis forward and head forward, but it's more like this, okay, flexion. This is gonna go somewhere below that bend point, okay, around the shoulder blades, okay? And now the feet are gonna line up with the shoulder, the ankles, and now they're flexed forward, and I want them to bend back into extensions, a thorax, rib cage extension against that block, okay? So I am activating the neck as well at the same time. So the neck is coming back at the same time. But this is one of the things I want you to really realize about correcting forward head posture is if someone has a neutral shoulder to hip, right, and the neck is forward only, which is very rare, usually people have combinations, then you just work on the neck position. But what if the neck is kind of neutral to shoulder, right? But it's the thorax that's forward, so my neck is still neutral to shoulder, right? Then you have to work on the thorax, okay? That's the primary posture. So that's why we're doing this extension, just like this, back like that, okay? Very good. Feels really good, actually. So it's an extension exercise, okay? And I will take some questions in the live right now. And of course, if you're watching in the replay, I'll answer them in the comment section. And if you haven't noticed, I do have a channel membership where I actually do members only frequently asked questions and shout outs and um, um, first replies to comments, personal replies to comments. So go check that out in the join button on my channel. Okay, good. Now, let me show you some of the tools, okay? So we give patients resistance bands, okay? So this is one of the resistance bands that we give our patients. It's called the pro-lordotic neck exerciser. There's red. In my videos, you'll most of the time see red. Okay, so red is the easy one we start with. Then goes blue, it's a little stronger, okay? A little stronger. And then goes green, okay? Also a little stronger. So these are called pro-lordotic neck exercisers. Now, we start them off with the mirror image exercise, and then we get them into resistance, okay? Now, there's a lot of reasons for using this. There could also be a military neck or a kyphosis in the neck. So military neck is a straightened cervical spine or loss of cervical lordosis. Kyphosis is a reversal. So this creates a nice bending fulcrum point for that versus a chin tuck. If you see my videos, chin tucks are not great for all people, right? If there's a kyphosis in the neck or military neck, it's not the best exercise. In fact, I would not do it. But you can bend the neck over a fulcrum point, okay? So if someone has a forehead position, I stretch this out, okay? So it has nice handles over here. So you hold this, designed specifically for this kind of work, okay? So there's a rubber tubing in there. Stretch it out, and I can do it in multiple different directions. If I go down, right? So if someone's like this, right? Then I teach them to go back against resistance, okay? There you go. So back against resistance, okay? And with this, they can do these rhythms. You can hold it for an extra second or two. And I start off with 15 repetitions. 15 repetitions. The next day we go to 2 sets of 15 reps, so it's 30. The next day we go to 3 sets of 15 reps, that's 45. Okay, so I usually get people to 3 sets of 15 reps, which is 45. And I'll show you all the different ways I can actually do this. Okay, so for people that are forward, we go down. Okay, so down, okay, like this, right? And then for someone that has the loss of curve or head position a little bit mid area neck, I can actually bring this up and go in this mid position and now turn the neck. See the neck? Turn and curl it over that spongy applicator on this tube, okay? Then I can also go up and then, wait a sec, up and go over, okay? Over, right? And then for some patients, I can do all ranges. So we do 15 down, 15 middle, and 15 up. Okay, and then there's some advanced moves we do as well for cervical kyphosis and loss of straightening of the cervical spine. Okay, so that's the red one, and then the blue one here, it's a little stronger. Okay, so eventually people can upgrade to the blue one, so it has more resistance. Okay, and then the green one of the prolordotic neck exerciser, the green one. Okay, a bit more resistance. And I have more posture correcting exercises on my channel. It's available to all the public, okay? So those are the key posture correcting exercises. These actually really work when they're done regularly, daily, repetitively. They work really well. I have so many before and after photographs of our patients. We use an app called Posture Screen, and we take them through our corrective care program, and we see many postural distortions improve with our patients on the photograph. So they do really work. I always advise that you get a thorough checkup. Go see a corrective care chiropractor trained in analyzing the spine on x-ray, full spine, front and side, trained in analyzing posture, front, side, and also any rotations, and then also trained in correcting it with traction work. Okay, so you may need traction work to correct that as well. And one of the best chiropractors that work on this and basically just focus only on this kind of work is a corrective care chiropractor trained in chiropractic ball physics. And there's plenty around the United States, plenty around Canada, and people message me or text me through comments below, or other messaging means online, to ask for referrals or to get a directory of these trained chiropractors. If you want that, just comment below, and then later on I'll just give you the directory where you can find one. Just plug in your zip code and you'll find that.